All right, let's get started. So welcome everyone for joining us. We are thrilled to have everyone with us here tonight. My name's Melinda St. Louis, and I am the Medicare for All Campaign Director for Public Citizen. We are excited to welcome you to this month's Medicare for All Resolutions Coalition webinar. And since the introduction of the Medicare for All bill in the House of Representatives in March, we've continued to build momentum in Congress. I think really even beyond what we thought might be possible in the current political environment. We talked last month about the exciting news of our organizing victories to bring on the chair of the Energy and Commerce Committee, Frank Pallone, and other members who hadn't signed on to the bill previously. And just today, Representative Jayapal's office confirmed that Representative Betty McCollum from Minnesota just agreed to co-sponsor the bill, which is really thrilling. She had never been a single payer supporter before. And so this again is showing our momentum. We've had additional local organizing victories in communities as diverse as Prince George's County, Maryland, Santa Cruz, California, and Princeton, New Jersey passed resolutions recently. These are really clear signs that while we still face enormous hurdles, because of the enormous spending, millions of dollars that are being spent by the big pharma and insurance industries, our continued organizing is making a real difference and can move us forward toward our goal of guaranteed healthcare for all. And just want to mention also another important victory. It's not directly related to Medicare for All, but our broader movement for health justice won an incredibly important victory against big pharma last week. A massive organizing effort pushed the Biden administration to change its position at the World Trade Organization and is now allowing for an emergency waiver to lift intellectual property protections for COVID vaccines. So to make that, it's a critical first step for COVID vaccines to be widely available all around the world globally to save millions of lives and stop the spread of dangerous variants. So pharma is not used to losing its policy battles, and they have an army of lobbyists, but we're showing that our people power can and will succeed in putting people's lives over corporate profit. So we're really excited to be in this fight with all of you. And really that work could not be more urgent as disparities in access to healthcare continue to have deadly consequences, particularly for communities of color. That has been particularly the case for immigrant sisters and brothers who have been often on the front lines for exposure of COVID-19 as essential workers, and they've been left out of COVID relief packages and continue to face discrimination in access to COVID testing, treatment, and vaccines. And we'll hear from our coalition partner, United We Dream, and a physician with expertise in challenging racial disparities in healthcare to learn more about how we can be in solidarity with those fighting for health justice in those communities. And we're also thrilled that we'll be welcoming Representative Sara Jacobs, one of our congressional Medicare for All champions in Congress, and Mayor Cathy Murillo from Santa Barbara, who has been a municipal leader in raising awareness for Medicare for All through the Mayors for Medicare effort and recent passage of a resolution through their city council. And we will be hearing exciting updates from activist leaders in Maryland, New Jersey, and Connecticut to share more resources of how we can support your local organizing. So please be a part of the conversation right where you're from in the chat. Let us know if you have questions or comments in the chat. You can send us a note to medicareforall@citizen.org if you're calling in. And if our panelists don't get to your questions in the chat during our time, we will make sure to follow up with you. So if you haven't signed up your community in our map or haven't been in direct touch with us for a while, we'll put the link in. Please sign up your community. And I'm really excited to get started. So I am thrilled to welcome Juliana Macedo de Nascimento, the Senior Advocacy Manager of United We Dream, the largest immigrant youth-led community in the country. United We Dream creates welcoming spaces for young people, regardless of their immigration status, to support, engage, and empower them to make their voice heard and win. United We Dream has been a really important coalition partner in the Medicare for All campaign, and we're eager to hear how we can be in solidarity with the health justice issues that are facing your community. So welcome, Juliana.
Thank you so much, Melinda, and thank you all for having me. I am so thrilled to be here. I know that my colleague Sara used to do these, so now I'm taking these on, and so I know these are big shoes to fill, but I'm trying. So yes, as Melinda said, my name is Juliana. I am a DACA recipient myself. I am originally from Brazil, but I grew up in California, Orange County. I see a couple of people from there on the chat, and but right now I'm based out of DC. So I've been in DC for the last couple of years, and I have to say I miss the weather. So, but I am here to talk to y'all about accessibility, right, to healthcare for undocumented folks. I grew up undocumented. My parents are still undocumented in California, and I've felt it, personally, but I also know that our membership or folks or communities have also been suffering quite a lot during this pandemic. COVID-19 has been really it doesn't discriminate, right? Especially based on immigration status. And so we know that our folks are in the front lines. We have over 5 million undocumented essential workers right now. Over 200,000 DACA recipients like myself are working in the front lines in essential jobs. And so we really have been feeling this in our communities, but we have largely been left out of all the benefits, all the relief that has come out in different bills, right? We have the CARES Act, the ARP, but they've all left out undocumented folks from most of the benefits. And so even from the healthcare perspective, even though the federal government had talked about how you would have access to the vaccines and to treatments if you didn't have documentation, if regardless of your immigration status, we know that the implementation of it on the ground hasn't been the same. And so we have heard of different states, for example, making residential requirements, right? You have to prove that you live in certain areas to get the vaccine. And undocumented folks, for the most part, are just that. We don't have documentation to prove anything. And so we are unable to bring a bill, even a bill under our name. We know that that seems like something very basic that everybody should be able to have, but a lot of us don't have access to that because we don't have access to IDs. We don't have access to driver's licenses in some states. So we know that, for example, there's been reports of folks in Florida being turned away. There was a report of a woman who has been turned away 5 times, and she's in the high risk category, right? And so from different points of distribution, from different places. And so we know that Medicare for all is something that's so important to us and that we fight for because we know it will benefit so many of us. But we also know that a lot of the devil's in the details, let's say, right? And so it's really about implementation. And so I just wanted to be here to put that give that perspective to folks, and use the vaccine accessibility as a prime example of something that's supposed to be universal and really easy to get, right? And still there are barriers for folks based on immigration status or where they live and where they come from. So I think I've said my piece. I think the last thing I'm gonna say is that I'm so happy to be here with folks from Princeton. That's my alma mater. I lived there for a year, and I'm so happy that y'all passed that resolution. So congratulations. But I'm gonna stop right now and give the mic back to you.
Thank you so much, Juliana. It's such a critical perspective, and I think we the Medicare for All movement must center and make sure that Medicare for All really means all. And that is a critical piece of the legislation and the new bill actually strengthened the language to ensure that that regardless of status, people would receive care. But we also know that that racism in healthcare is something that we have to address from the ground up and not just through policy. So thank you so much for being with us. And I think people are very excited in the chat, and you can take a look at that as well. So now I'm really pleased to invite Dr. Monica Maalouf, who's an internal medicine physician at Loyola Medicine in Illinois. And she's a member of the Physicians for National Health Program, a really critical partner in this coalition effort. Dr. Maalouf, can you share your experiences of providing care in the pandemic, and particularly how our profit-driven system exacerbates racial inequities in healthcare? Thank you for joining us.
Yeah, thanks for having me, Melinda. So as Melinda said, I'm a practicing physician in outside of Chicago. I spend most of my time seeing patients in clinic as a general internist, and I also spend about 20 to 30% of my time teaching students and residents. And I've been involved in the single payer movement for several years, and I'm currently one of the co-presidents of the Illinois chapter for Physicians for a National Health Plan. Even before the pandemic started, I think what I realized early on when I became a physician was that every single day in my practice, the question of finances works itself into the exam room. Every single day, I am grappling with questions of, can the patient afford this treatment? Is insurance going to cover it? How do I get the patient the best care they need, and not just the care that's affordable to them? And I think what we've seen during this pandemic is that racial disparities that already existed have been magnified. The pandemic didn't create problems, but it put a magnifying glass on vast inequities that already exist in our system. As we know, communities of color, Black and Hispanic and Mexican communities locally, working class Americans who are working high-risk jobs are also more likely to be victims of systemic injustices that make them more likely to have chronic diseases. So a lot of my Black and Hispanic patients who I take care of on a daily basis are patients who historically have had really bad access to healthcare, have had issues affording medications, have high-risk diseases like diabetes and hypertension, and which all predispose them to getting more sick from COVID if they get it. And those are the same patients who are working high-risk frontline jobs in restaurants, in food processing, in factories. And I think that this past year, what I've seen is all of those inequities kind of come to a head, where we've seen these communities face both increased exposure, increased risk, and increased death and devastation from the COVID pandemic. And I've seen it play out on a daily basis. I'd like to share with you just a couple of stories from my clinic. One of them is a patient who I've known for several years, who she works as a housekeeper. She's 63 years old, and she has been trying to retire for a really long time. She has decided not to retire because her husband has cancer and they rely on her insurance to pay for his cancer treatments. And this is something I see all the time. People in their 50s and 60s pushing off retirement because they're worried about health insurance and the ability to afford healthcare in their early 60s before they can qualify for Medicare. And so she's put off retirement. She's working tirelessly despite the fact that she's had multiple knee replacements. She has really bad arthritis, but she kept working. And she works in a high-risk job in a hospital, and she was exposed and she got sick with COVID. Thankfully, she pulled through. She's doing fine now. But it just highlighted to me so many problems in our system, right? That she still had to work not because she wanted to or she needed to financially, but because she needed health insurance for her husband and herself. And she put herself in a high-risk situation in order to get that health insurance. And to me, it's like tragedy. It breaks my heart to see these stories play out every day in my practice. My team and I work really hard to make sure our patients are cared for, but we have to move past the compassion of individuals and work towards building compassionate systems. And I think a big step in that direction is the fight for Medicare for all. So I'm really excited to see the momentum building this year. I think that it feels closer than it's ever felt. So I'm motivated and inspired by all the work that's being done by Public Citizen and other activists on this call. So thank you for all you're doing, and I'm happy to talk more, answer any questions anybody has. Thanks for having me.
Thank you so much, Dr. Maalouf. It's such a critical and important perspective, and thank you for all that you're doing on the front lines as well. Now I'm really honored to welcome Congresswoman Sara Jacobs, who represents California's 53rd Congressional District. She is at the age of 32. She is the youngest member of California's delegation and the third youngest member of the 117th Congress. She serves as the freshman representative to the House Democratic Steering and Policy Committee, which is very exciting. And she's been a strong advocate already for Medicare for All. So we would love to hear from you, Representative Jacobs, how you see the growing momentum for healthcare justice. Now we have 116 co-sponsors to the bill, and how grassroots activists around the country can support you in the work that you're doing in Congress. Welcome.
Well,
thank you.
Thank you. Thank you so much, Melinda, and everyone at Public Citizen and everyone who's tuning into the webinar around the country this evening. So I represent California's 53rd District, which covers San Diego. This is my first term in Congress, and I'm very proud to be an original co-sponsor of Medicare for All. So as Melinda said, I'm young, I'm a millennial, and honestly, that was one of the main reasons I decided to run for Congress, because as a young person, I know we can't keep doing things the same way anymore, and we need transformational change, and we need to build an economy and a society that's just and fair and sustainable and prosperous for everyone. And I believe that Medicare for All is an essential part of that. So I'm not going to spend this whole time telling you why Medicare for All is important. You already know that. You heard so eloquently from so many of the speakers before me about why we need it so much. But I am going to tell you why it's not just morally right, it's economically right. Because during this pandemic, millions of people lost their job, and with it, their employer-sponsored healthcare, if they even had it to begin with. So we've now had so many more people see very concretely why tying your healthcare to employment makes no sense, especially in the midst of a pandemic. And we're seeing millions of people essentially relying on government to access healthcare, whether through Medicare, Medicaid, expanded ACA, and COBRA subsidies. So it only makes sense to actually figure out a rational, comprehensive plan to get people coverage instead of the piecemeal approach we have now. And I can tell you that through all of your hard work and because of this pandemic, the conversation in Congress really has changed. As you know, my friend Congresswoman Pramila Jayapal reintroduced HR 1976 Medicare for All in March. We now have over 116 co-sponsors, over half the Democratic caucus, and more impressive to me, that's nearly twice as many co-sponsors as we had in 2015. So I'm not going to paper over that not everyone in our caucus is totally on board, but I can tell you that there is more unity around universal healthcare than there ever has been. And we're seeing that right now with this broad coalition led by Congresswoman Jayapal and Congressman Golden around getting, at least in the American Jobs Plan, the Medicare age decreased and the benefits expanded. So there's also more of an understanding in our caucus right now that we have to go big and bold to address the deep economic crises that we're facing. I mean, Joe Biden knows we have to go big and bold to address the deep economic crises that we're facing. And that's where the work of people in our local communities, people like you, are so important. Because I know that when my colleagues go back to their districts, whether they're moderates, progressives, or Republicans, they're hearing from their constituents about healthcare. The uninsured rate has increased every year since 2016. That's 4 straight years. The uninsured rate among children went up even faster. 726,000 children lost their healthcare coverage during the last administration. And the arguments that you're making are so important, that when we fail on healthcare, it has impacts across all communities, all level of governments, across states and local budgets, on social services across the board. And we're seeing how impactful a failure of healthcare is right now with this pandemic. So thank you for what you're doing. We're going to keep working here in Congress. The American Rescue Plan was an important first step, but of course, we have a lot of work to do. And honestly, the argument y'all are making is so impactful because it's simple. In the wealthiest country in the world, there is no reason people shouldn't have the healthcare coverage that they need. And Medicare for All is how we get there. So thank you for all the work that you're doing, and I'm honored to be a partner with you in this work.
Thank you so much, Congresswoman Jacobs. We're just thrilled that you're in Congress. We're thrilled to have you fighting on the inside, and we will do what we can outside, and that's kind of part of what this Medicare for All resolutions campaign is about. So thank you, and count on us. So we appreciate you taking time out of your very busy schedule. So thank you so much for joining us. And so now I'm also thrilled to invite Mayor Cathy Murillo, who has served as the mayor of Santa Barbara since 2017. And prior to that, she served on the city council in Santa Barbara. And Mayor Murillo helped to champion a Medicare for All resolution before the Santa Barbara City Council in February. And she's a member of Mayors for Medicare for All Network, which is an exciting network. And so thank you so much for joining us. And we'd love to hear some of your insights. But what we're doing here is trying to educate municipal officials around the country about the importance of this. And so any advice you have for activists approaching their local elected officials, why you chose to do this would be great. Thank you so much for joining us.
It's my pleasure, Ms. St. Louis, and thanks to Public Citizen for organizing us today. And I think you're right that it's these concentric circles. We're creating some energy, and it's going to emanate, and we will get to where we need to be with universal health care for everyone. The Santa Barbara City Council passed a Medicare for All support resolution February 23rd. It was straightforward, very short. We were honored to have healthcare advocate Addie Barkin participate in our hearing as a public comment maker. And our resolution did acknowledge that many families lost their health insurance when they lost their jobs because of the pandemic. But our resolution built on many years of community activism. We have an organization in town called Healthcare for All Santa Barbara. They met monthly. They put on workshops for years, and they supported various efforts over the years, like Sheila Kuehl's bills. For those of us who were here in 2003 and 2005, when there were other efforts in the state of California. The League of Women Voters was also very active in our community. They hold community conversations, and more than one of them was about the need for single-payer healthcare. We also had the California Physicians Alliance was active in Santa Barbara for a short time. Dr. Bill Skeen, I don't know if any of you knew him. He passed, rest in peace, but he did such great work. They organized a benefit concert of gay men who were singing in a chorus, and so very they engaged the community in various ways to be excited about healthcare for all. And so I just wanted to give a shout out to Bill Skeen for the work that he did. So in Santa Barbara, the other thing that created support for this was the safety network that we have. And I assume other communities have neighborhood clinics. So we have a network of nonprofit neighborhood clinics. There's an American Indian Health and Services. Doctors Without Walls is huge in our community. We have a large population of unhoused residents, and they deliver medical care in the park. And so people understand that these groups help us because we don't have a universal system. And I just want to give a shout out too to Doctors Without Walls. I was just in a meeting before this about homelessness response, and Doctors Without Walls have vaccinated more than half of our unhoused residents. So everybody chips in, right, when you don't have exactly what you need. from the municipal government point of view, you know, we have retirement costs, and some of them are related to medical care for retired public employees. We would be helped by having healthcare for all. Again, our unhoused residents would benefit from affordable, accessible medical care and treatment, including mental health services. Let me throw that in there. And then Santa Barbara has a reputation for being a rich city. Yes, we have some wealth and high property values, but our tourism industry is supported by working families. To Ms. Macedo de Nascimento, we have a large, well-respected labor force of undocumented folks who make the economy turn here in Santa Barbara. And so they definitely need, they and their children deserve to be healthy. So I joined Mayors for Medical for All somewhat recently, and it was started by Long Beach Mayor Robert Garcia and Oakland Mayor Libby Schaaf. And so I'm working right now to recruit other mayors in the county, and change needs to happen at the local level. We need to build up local support. And when you talk to people, they will tell you, oh my gosh, my cousin went broke paying for his cancer treatments, or, you know, they're really sad, painful stories, and people know we need to get there. It seems impossible, but I guess I'll close by saying it is possible. We need to keep pushing forward, and we need to keep believing we can make this happen. Thank you.
Thank you so much, Mayor Murillo. We really appreciate, we know that you're very busy, and so thank you so much for taking time out of your schedule and for being a local champion. We really appreciate that. Thank you so much. So now I would love to turn it over to my colleague, Brittany Shanahan, our national organizer with the Medicare for All Resolutions campaign, to share some of the tools that we have and to introduce some of the local activists who have been doing incredible work around the country. Brittany.
Hi, everyone. It is great to be with you all again and to share this space with the amazing speakers that Melinda has lined up for this month. My name is Brittany Shanahan, and I'm the Medicare for All organizer at Public Citizen. It's been my pleasure to work individually with many of you here tonight to move resolutions forward in your communities, and I'm always excited to work with new folks. In our last webinar, I went over some resources in our toolkit to help you get started with organizing for a municipal resolution in your community. This time I want to fast forward a little bit and show you some of the resources and guidance we offer at the later stages of the resolutions process so that you can know what to expect. And the reason for this is in almost every case, the heaviest lift in getting a resolution passed is actually building that initial relationship with a council member or a county commissioner and obtaining a commitment from them to introduce your resolution. I know it sounds confusing that the council vote is not as challenging as that part. You would think that the council vote is that big moment that you have to work the hardest. You do have to work hard, but it's different. So I know it's confusing that it's not as challenging as you might think. And there's more to explain this that I have time for today. And I'm always happy to chat individually with you all about how this works or come to one of your group meetings. So let me bring up our website with our toolkit. Screen one. There we go. Okay. So, Melinda, is this showing the right page? Okay, great. So our Medicare for All Resolutions website, under Tools for Activists, we have this general section here with that takes you through different steps of passing the resolution. So I'm going to go here, plan for the passage of your resolution. Now, with the understanding that I said earlier that the council vote isn't necessarily about, like, you're on your way to passing your resolution at this point. It's not as hard as the earlier parts. let's talk about some of the objectives at this point. The first objective when you're at this stage is you want to use the council hearing as an opportunity to mobilize Medicare for All supporters in your community and to build your movement. Having people be part of this victory, whether it's calling in to a council member or testifying, it makes them feel included in this movement. It makes them feel a part of it, and it makes them more likely to stick around. And it makes them give you their email address, and then you can work together on another resolution in the future or other Medicare for All organizing. The second objective is to do what you can to secure a unanimous vote. If a resolution is on a city council agenda, chances are it will pass, but you do want to get everyone on board. So as soon as you have an idea, a general idea of when the vote is coming, you want to call or email us so that we can help. We will work with you to generate a call list and a script that your supporters can use to encourage council members who haven't yet committed to supporting the resolution. We also have interns with us who make these calls for us to make it a lot more easy. And we'll also reach out to our own subscribers in your area who we can count on to call their council member. As well as all this, we'll share a call to action with our national partners so that they can alert local chapters. Now, some activists have also used a petition tool to email the council as a whole. If you're working with a chapter of a national group or there's a website person or somebody who's communications, that person is usually miles ahead and they have done that themselves. So we do have this petition tool here that you can use for that purpose. If you have like an Action Network or account, or you're using some kind of petition software where the person is emailing, by signing it, it's emailing the whole council. You can use this sample petition we have here, the sample petition language. Oh, it's a download, but it is there, and you can also use this thing to solicit speakers for the hearing. So when somebody's signing up, in some cases our partner, like whoever has set this up, they've made it so you tick a box that says tick a box if you'd like to testify. In addition to that, through our partnerships with PNHP, NNU, and other national organizations, we may be able to find local doctors and nurses to testify. We do also have sample templates. So let me go back to this page. We have these sample templates here that you can use to share with folks who are planning to testify so that they can prepare. These are actually designed to last the duration of the amount of time people are usually given to speak, which is either we have a 90-second version and a 3-minute version. And you can use it to kind of time yourself and figure out how long your section should be. Now, the final area here to prepare for, again, this goes into this objective of using this to build your movement and using this to make a local splash, to make Medicare for All like an issue that your community officially cares about. And that is the media work and press work. Now, you'll want to get your press release ready ahead of time so that you/we can distribute it as soon as the vote passes. And we do have a sample press release language here. Now, also, if you go to our main website and you find our map, there's also on the list of past resolutions, there are also some links to press releases and to local press coverage that you can see how it looks like after it goes through. So one thing that is really useful is, I talked about getting those speakers before. If you can get blurbs from them ahead of time, like a quote from the testimony they're planning to give, and put it into this press release, it's if it gets picked up by the local press, it's quite likely that they'll just pick it straight out of there, put it straight in to the piece, because if it's going to make their lives easier, a journalist is happy to do that. The other thing is that our comms team, we have a comms team at Public Citizen that we work with on getting ready, preparing for press, and they can also work with you on the press, as well as if you don't have contacts with local media, or if you want to just tell us which papers we should be contacting, we can send it as well, if that's a help. And then another aspect, another area where comms can help, and this doesn't always fit into just right at the moment when you're preparing for the vote, is that they have also worked with activists and council champions to draft and edit op-eds for local papers explaining the importance of the resolution. And we do have a letter writing guide here, and our team would be happy to work with you if you have the questions. I'm sure Melinda's been sharing the links here in the chat. In case you missed it, all you got to do is go to the top, Tools for Activists, and you're planning for the passage of your resolution. So let me stop sharing. Okay, so, but next, that's enough from me. I'm delighted to introduce you to some of our activist speakers. And first and foremost is my own very dear friend, recently relocated from Maryland to Colorado, Sydney Jacobs from the Maryland Progressive Healthcare Coalition. Sydney was a driving force between the recent victory in resolution victory in Prince George's County, Maryland. It's good to see you, Sydney.
Good seeing you too, Brittany. Thank you so much for inviting me to participate here. This is really an honor, and it's exciting to hear about all the work going on around the country, and some of the great things that are happening everywhere. And the toolkit that Brittany just was talking about was very handy. We found it very handy, especially when we were getting started. So Prince George's County is a large suburban jurisdiction in Maryland. It's located just east of Washington, D.C. The population of just under 1 million people is a minority-majority demographic that plays a major role in the high rates of health issues that are associated with people of color and large numbers of people who are uninsured or underinsured. So there were several factors that made Prince George's a really good prospect for a resolution. The first was that this past fall, the RAND Corporation released a comprehensive report on the state of the county's public health, which essentially kind of shouted to elected and appointed officials that Medicare for All is the only way all county residents will ever receive the comprehensive health care and public health services needed. The second factor was that Prince George's County was particularly affected by the coronavirus pandemic, with some of the highest infection and death rates in Maryland. A third factor was that significant numbers of undocumented frontline workers without insurance are concentrated in certain parts of the county that suffered very high rates of COVID infections. And finally, the county is represented by 2 people in Congress. In District 4, Anthony Brown is the congressman from there. He has been a champion for Medicare for All. It took a little pushing, but he has signed on to the bill the last couple of rounds, including the current one. And we have thanked him profusely for that. The other congressperson in District 5 is Majority Leader Steny Hoyer, who, of course, I'm sure you're all familiar with him. We have harassed him, bird-dogged him, had meetings with him, and we were hoping that getting a resolution passed would send yet another message to Mr. Hoyer that supporters of Medicare for All are not going to go away. So once our team decided to pursue a resolution, there was some debate as to who to approach to be the sponsor. So the County Council has 11 members, 9 are representing districts, and 2 are at large. The vice chair of the council was our target. She's the only Latina on the council. Her district has high numbers of both documented and undocumented immigrants. It contains the zip code with the highest number of COVID cases in the state. And the council member also has experienced the pandemic tragedy very personally. So we set up our first meeting with her, and she was a bit of a hard sell. She knew almost nothing about Medicare for All or the concept of a single payer system. Using evidence from the RAND report and connecting the weaknesses of our current system to specific situations experienced by many of her constituents, we finally convinced the council member to sponsor the resolution. So in preparing for having the resolution introduced to the council, we had a lot of organizing already in place. We had the full support of the Maryland Progressive Healthcare Coalition, which is a statewide group of activists focused on Medicare for All. And locally in Prince George's County, we also had very strong connections and relationships with a number of county activist groups who supported Medicare for All and or who had worked with us on bird dogging our congressional reps over the last few years. Our resolution sponsor gave us the names of community health organizations in our district that serve immigrant residents she thought would be supportive of Medicare for All. And we had several fruitful conversations with them. And that expanded our coalition to include groups that we had been trying to reach out to. So that was really good. As to the resolution content, we offered to write a draft resolution for the council sponsor, which she readily agreed to. We drew heavily from the RAND report and connected that information to how Medicare for All would greatly improve the health of Prince George's residents. It would save the county tens of millions of dollars in healthcare coverage for county employees and retirees, and it would vastly improve the overall health of the residents. The resolution, as we drafted it, was accepted by the council member in its entirety. When the resolution was introduced in mid-March, 2 council members had signed on as co-sponsors. During the first hearing, and it was just an introductory hearing, 4 more also became sponsors, bringing the council support to 7 of 11, enough to pass at the next hearing. Among these sponsors was the council chair himself. But needless to say, we were pretty excited, and we did relax our efforts in outreach a bit too much. In other words, never count your votes before they're hatched. The second hearing was on April 20th, and it was our opportunity to send letters of support and testify in person, of course by Zoom actually. We'd carefully thought about who would have the most impact to testify in person. So we chose a local provider. It was a doctor who works locally, a doctor of color. We had a nurse activist. We had a young local African-American mayor, and we had a director from one of the immigrant community health organizations. Just as that hearing, the second hearing was getting underway, kind of the unexpected happened. Our resolution sponsor introduced friendly amendments just before the public was allowed to testify. The council members had only received the amendments moments before the council session. And of course, none of us activists had any idea that our sponsor was going to be doing this. So needless to say, there was a lot of confusion on the part of the council members. We were pretty angry activists. We felt betrayed by the sponsor. Turned what we thought was a win into kind of a confusing mess. So what happened at that hearing is the majority of the council did end up voting to accept the amendments, though many weren't really sure what they were actually supporting. So after this rather contentious hearing, and kind of getting over our dismay, we reviewed the amendments, and essentially they concerned what turned out to be pretty minor changes in wording. The resolution as an instrument of support for Medicare for All was actually still intact. And I want to just do a special thank you to Melinda, who spoke with one of our activist leaders, Christy, and helped us spin what we thought was a loss actually into a win. We had one particular champion on the council, and we let him know we wanted the council to pass the resolution unanimously, amendments included, which it did 2 weeks later on May 4th. So kind of the final actions included a press release, of course, as Brittany said, preparing it ahead of time with quotes is really helpful, which we did. We praised the county council for being the first one in the state to support Medicare for All. We put, I think, a sentence in there about how Anthony Brown already was a supporter. And then we also want the council to send the resolution to our congressional delegation. This does require action on the part of the resolution sponsor, and we're working on that now. We have someone who is a constituent of the sponsor and knows her well, and we're hoping that that our sponsor will take that next step and send it on to our delegation.
Awesome. Thank you so much. That was it was a lot of work that went into this, and I'm so glad that you were able to just sort of dissect it bit by bit so that everyone could see like how you got there, because the important thing is that you did.
Mm-hmm.
So next up, sorry, next up, I've got Sivan Amar in Connecticut with the Medicare for All Connecticut organizing group, which has been working really hard on resolutions for a while now. And I think Sivan has an update on New Haven.
Yes, hi everyone. Thank you so much for having me. And thank you everybody on the panel and all of the attendees for all of their amazing work as well. I joined Medicare for All Connecticut earlier this year. And since then we have incorporated as a nonprofit institution. And so we as an organization are working on the local, state, and national level to influence policy and educate the public on Medicare for All. But on the local level, we are working super hard to pass resolutions. Prior to my joining in 2020, another town, New London, which is about an hour away from New Haven, actually passed their town resolution unanimously. And then in January of this year, Windham, a town in northern Connecticut, passed theirs as well. We're a small state, only 3.5 million people. So I think there's about 150 towns in Connecticut. So we're on our way to getting there. So with New Haven, we are one of the major cities of Connecticut. This is where Yale is, and the Yale New Haven Health Hospital is centered here as well. But Connecticut also, in general, is home to the insurance companies. We're the insurance capital of the world. So there had been talks with a lot of other local groups such as DSA, Indivisible, organizations such as that, to work on something like this. And so with New Haven, we sort of merged to become a coalition. So we're now the New Haven Coalition for Medicare for All. And we actually had our first, it was called we have a board of alders here. And so we had our first workshop with them to really explain to the Health and Human Services Committee of the Board of Alders what this resolution would mean, what Medicare for All means, and what it would mean for New Haven. Because we are actually quite a segregated city. There's Yale, which is very white, very old school, you have that idea of Ivy League. And then students are actually told, when they get here, don't go past a certain street, which I'm sure is not uncommon in a lot of maybe university towns. But those people work here, they live here, they are the foundation of our communities. They're the permanent residents, whereas the Yale attendees are rotating, you know, with school semesters, things like that. And so what we are focusing on really, for the most part, for our resolution effort is to ensure that these communities are heard, are seen, and are part of the resolution effort. We're not going only to, you know, the Yale students or the affluent neighborhoods. We're specifically and intentionally ensuring that all communities are heard and seen. And so with that in mind, we had a wonderful first meeting with the Health and Human Services Committee. Some of them are very friendly to the cause. Yale also has a union. And so one of the members, one of the alders is a union member. So that helps. And basically we had over 45 people in attendance on the Zoom, and then almost 100 people had given written testimony. We actually have, with Medicare for All Connecticut, we use Action Network, and Brittany and Melinda we were thrilled. They had shared our sort of action to request that people send in testimony. And it's a very quick and easy digital advocacy tool in which people can, you know, put in their name and send an email off on the spot, or they can customize it as they wish. And so because we ran out of time in that meeting, there were so many people, they have recessed to a second meeting, which is fantastic. And we are going to be planning for that. Our coalition formed an organizing committee so that we can take care of the sort of day-to-day activities for those, you know, members who maybe, you know, can't do everything day-to-day. And we're planning, you know, tabling events, we're planning phone banking, we're planning petitioning, and hopefully we'll achieve all of those over the summer to really go out into the community and ensure that everybody has a say in this. We actually were in the news, the Yale Daily News, which was a great and wonderful surprise, covered us. So we're gaining traction in that sense. Yeah, I think that basically explains where we're up to right now with our efforts. And again, if this passes in New Haven, we think it'll just send a huge shockwave throughout the state. Again, because we have such a famous hospital system here that's tied to insurance. And we also have, Melinda and Brittany have put us in touch with other individuals who are looking to start resolutions in Hartford. My friend Tony Lee is here. He wants to try for East Hartford. That's the capital and the city next to, and that would just blow the roof off of this thing. So we're really excited. Thank you. And thank you guys all for your amazing support.
Thank you so much, Devon, for coming and sharing this with us. It was definitely the way that you used Action Network. I was looking for trying to find the link for the petition that you all used, but they.
Oh, I can. You know what? I'll find that and I can drop it in the
sort of thing I'm talking.
Yeah, I'll find it and I'll drop it in the chat. We like I said, it was over 100 and some odd thing, and it was just, you can always refresh the page, you know, on the administrator side, and just seeing it keep going up and up. It was really exciting. So
yeah, awesome. Thank you so much for coming tonight. So last, I have to add a little hint of final spice. I've got Mark Pepper from Our Revolution in Trenton Mercer, and you know, keeping with the Ivy League theme, because this is we are an elite campaign, are we not? Mark is here to talk about the recent resolution victory in Princeton, New Jersey. Oh, Mark, I think you're muted.
All right. Okay, I've lived with Dr. Pepper jokes my whole life. I actually did go to medical school, so I am Dr. Pepper. And I'm sharing that. I'm glad I'm going last. I loved hearing what everybody had to say, especially the effort in New Haven and in Prince George's County. I have to say, I'm in awe of everything that everyone has been doing and all the speakers. I have to give some background. Full disclosure, I went to the University of Pennsylvania, and I've lived here. Actually, I live in Princeton Junction, which is on the other side of Route 1 from Princeton. It took me a while to get comfortable living across Route 1 from Princeton, being a Penn alum. But I love living here now. I love Princeton. It's a great town. And I've lived, like I said, I've lived here 30 years. When my senior year at Penn, I took a course in hospital administration. That was in 1978. And the big thing then was HMOs. And that was supposed to save us and make healthcare available for everybody. And obviously that didn't happen. And I then did a residence, and I went to medical school in Philly. I worked at HUP for 4 years, Hospital at the University of Pennsylvania. I worked as a lab technician. I then went to medical school. I graduated in 1990. I got to do my residency at Pennsylvania Hospital at the height of the AIDS epidemic, and Pennsylvania Hospital was one of the epicenters of AIDS, treating AIDS patients. I then decided not to continue practicing medicine. I ended up working in the pharmaceutical industry for about the next 10 years. And as Sivan said, Hartford is the health insurance capital of the world, where New Jersey is the pharmaceutical, big pharma capital of the world. So just about everybody in New Jersey works in some capacity at some point for the pharmaceutical industry. So with all those experiences, it was clear to me for the longest time that our healthcare system was not working, and we needed this. Absolutely, it's just without question. And the other really good thing about New Jersey, it's a small state, so it's very easy to get around from one end to the other. Especially the last 4 years, Princeton is a hotbed of activism, which is why I really love living here now, because there's all kinds of great groups, activist groups, coalitions, and a coalition is the way to get to where we're trying to go. And I'm part of Our Revolution, Trent Mercer. It's a new chapter. We're really trying to get getting organized. We have the benefit of a great organization throughout the state. And I said, I think now that I've finally grown up, I figure out what I want to do, and I want to be I love doing advocacy work and activism, and I love working on Medicare for all. We just have to have it. So I was contacted by our state organizer in August, and because she knew I was very involved in Princeton, I'm not living there, but I'm a member of the Princeton Democratic Club, which is the largest Democratic club in New Jersey. Very high, very well-informed voters, very involved. You say Medicare for all. Oh, sure, absolutely. So I was contacted to reach out to the Princeton Council. As was said before, the relationship is key. Building the relationship with a council member, the mayor. I had the advantage of, I've lived in this area for 30 years. I've been involved with passing resolutions in my own town, Princeton Junction, because I knew everybody on the council. So it was very easy for me to contact the council member and say, hey, there's this resolution we'd like to pass. In particular, there was I'm involved with a group called Represent Us, and we passed the American Anti-Corruption Act resolution, which is to try working to get the big money out of politics. All right, so I had that experience. I was contacted to approach Princeton, and I figured, of course, it'll be an easy lift, right? Because they're all on board. They're educated. There was not a big, it should have been a very easy lift. The problem was it's still Princeton, and Princeton is a wonderful council, very thorough, very busy, very busy. I was contacted in August. I kept reaching out to different friends I knew in Princeton, hey, can you help us, reach out to a council member? I knew some council members, but I didn't have a close relationship with them. A neighboring Our Revolution chapter in Middlesex, where I'm in Mercer County, the neighboring county, Middlesex County, just so happens someone in that chapter was personal friends with a Princeton council member. She introduced us through email. That got the ball rolling. That was sometime in the fall. We set up a meeting, I sent an email to try to set up a meeting with at least one or two of the council members. We actually ended up with 3 council members on board. But the problem was trying to just find a meeting time. I mean, we were already in the door. There was no hard sell. The email response I got was, oh, absolutely, we'd like to meet with you. We're interested in this, in passing a resolution in Princeton. The meeting our initial meeting did not happen until January because they had so much on their plate in the town council. We finally met in January, our initial meeting, and Princeton being Princeton, the discussion went very well. They're interested. They said, oh, well, we need to pass this through 3 of their committees, their Health and Human Services Committee, their Health, a couple, 3, there were 3 committees, and they wanted to, build the support of the committees and build the support of the residents of the town. It all made sense. Unfortunately, it just kind of slowed things down a bit because we kept, reaching out. How's it going? Has the council, have the committees decided, to go forward with this? There was just one delay after another. We finally, I got more Princeton residents involved who were involved with the Princeton Democratic Club, who were constituents in the town. It just took a lot of emailing back and forth, setting up, trying to set up meetings where everybody was available. We finally broke through about 2 weeks ago where we had a follow-up meeting. Nothing ever happened with any of these 3 committees, and the council members we met, there were 3 of them that we met with. They all said, look, we realized, they felt bad that it had taken so long. They said, look, we'll skip the committee discussions. We'll put it on our next council meeting, which was April. Oh my goodness, I can't remember. It was a few weeks, May 10th. It was May 10th, Monday. It was put on their council meeting at the end. And again, Princeton being Princeton, it was a marathon session that it lasted for 4 hours. We were just about the last item on the agenda. The council members gave us specific instructions. They only wanted 2 people to testify because they told us it was going to pass unanimously. They had, they wanted to do the vote. They wanted only 2 people to testify, both Princeton residents. So I wasn't able to testify since I'm not a Princeton resident. But the 2 people, one was, they were both Princeton residents and members of the Princeton Democratic Club. They stayed on the call for 4 hours and then finally testified. It passed unanimously. We got a quote from one fellow and 1 council member. Those quotes were then released in a press release since Monday. And it was, I kind of feel like we got off easy, except that it took so long. I thought it was something that was going to happen in a few months. I thought by the fall we would certainly have had this passed. It finally happened, just this past week, and we're all thrilled. And we're really, Princeton really, we feel that now that Princeton's passed it, I think we're the 8th town in New Jersey to have passed one. We have Essex County that has passed a resolution. That's where Newark is, the biggest city in New Jersey. Mercer County is a very key county. It's where Trenton is. Trenton is really, in bad shape. A lot of poor people, no health care. It's just, we're hoping now we can get more towns on board now that Princeton has passed. We're working on Trenton, several of the other towns, and then, other counties as well. So, so that's what we did. And it was not the, you know, in the end, it really was an easy lift because we didn't have to convince everybody. They were all on board. It was just a matter of getting all the ducks in a row so anyway, that's our story.
That's terrific. Thank you
Yeah.
so much, Mark. And really, I think the lesson was persistence. We saw that a bunch in the chat that
Yes.
it often does take persistence, but it's
Yes.
definitely worth it. And so congratulations to you all.
Yeah, and we had a great team. I forgot to
Yeah.
mention, we had a really great team. We all worked well together and got it done.
Yeah, no, that's great. And it can be a really great community building effort as well. So thank you. And I just want to thank everybody. I mean, we've had just such incredible speakers this evening. I really want a special thanks to Representative Jacobs and Mayor Murillo, who took time out of their busy schedules, and Juliana and Dr. Maalouf for sharing their expertise with us. I hope you all have been as inspired as I was about, as we've heard, for valuable lessons about creativity and persistence and never accepting no for an answer that got us these victories. And really, I just want to thank everybody. And really, no matter where you are in your organizing journey, we really want you to know that we're here to support you. There are activists around the country that want to support you. And please do use the toolkit, the resources that Brittany pointed out. You can make sure your town is on the map. Be in touch with us, and we'd love to know what you're up to and how we can support you. So thanks again for all of your energy. We had great conversations in the chat. We will follow up with you if we didn't get to your questions, but I really appreciate all of the organizing that people are doing among themselves in the chat as we do these webinars. So thank you again. Mark your calendar. Our next webinar will be on Wednesday, June 16th. We've already confirmed Representative Tony Cardenas from California. So we're really excited about that. And so you won't want to miss it. And thank you again for joining us, and have a great evening. Take care.